My name's Mike Widmer. I'm one of the cardiologists in Bend, Oregon. I've been involved with the Oregon ACC for a number of years. And I'd like to thank the state of Oregon for helping to sponsor the summit this year. For those of you who may have joined us in 2009, we kind of started off with a challenge. And I thought that it'd be important to go over that challenge again as part of our introductory remarks.
William Bradford, speaking in 1630 of the founding of the Plymouth Bay Colony, said that all great and honorable actions are accompanied with great difficulties, and both must be enterprised and overcome with answerable courage. If this capsule history of our progress teaches us anything, it is that man in his quest for knowledge and progress is determined and cannot be deterred. The exploration of space will go ahead, whether we join in it or not. We mean to be a part of it. We mean to lead it. For the eyes of the world now look into space, to the moon, and to the planets beyond. Our leadership in science and industry, our hopes for peace and security, our obligations to ourselves as well as others, all require us to make this effort, to solve these mysteries, to solve them for the good of all men. There is no strife, no prejudice, no national conflict in outer space as yet. Its hazards are hostile to us all. Its conquest deserves the best of all mankind. We choose to go to the moon. We choose to go to the moon. We choose to go to the moon in this decade and do the other things. Not because they are easy, but because they are hard. Because that challenge is one that we're willing to accept, one we are unwilling to postpone, and one we intend to win.
So when we were working on developing the first STEMI summit, we thought about Kennedy's moon speech as an example of rising to meet a great challenge, a daunting task. And in 2009, our daunting task at the time was to try to develop a statewide system of STEMI networks. And the take-home messages from the first STEMI summit was that this was going to be a long process. We knew it was going to take a lot of time, a lot of work. We needed it to be comprehensive. All stakeholders, EMS services, cardiologists, nurses, cath lab folks needed to be involved in this process, and that it was going to take incremental steps. We weren't going to get there all at once, and that we had to make adjustments for certain localities and limitations of geography, and that we needed to track outcomes. We needed to provide feedback to the members of our STEMI networks, and we needed to share what was working and what wasn't. And so our efforts at developing a statewide system of regional networks was started in 2009, and our efforts kind of culminated in House Joint Resolution 54, which was essentially the legislators' support for the Oregon ACC and the AHA for developing a statewide system of regional networks. And so that was our intent. That was our goal. We had intended for more summits to subsequently follow. That didn't happen. What did happen was that later in the year, in 2009, the American College of Emergency Physicians, every few years, grades the state's EMS systems. And in late 2009, they published the grade for the great state of Oregon, and they gave our EMS system a D. Now, no states got A's, and very few states got B's. Most states got C's, but we got a D. And there was a number of reasons for that, but pertinent to our discussion, what we got dinged for was that we did not have a statewide STEMI network. And so this caused a lot of wailing and gnashing of teeth at the state level in Salem. And so the governor put together in 2010 a task force to address this poor grade. And the task force came out with essentially three general recommendations. Task force recommended that care should be regionalized to ensure access but avoid duplication. There was a recommendation to form an emergency healthcare board, of which, again, pertinent to our discussion, that there was going to be an acute cardiac disease subcommittee. There was also a recommendation that we needed a statewide data collection system for analysis and quality improvement. There was also timelines that were provided by the task force. So in 2012, the task force recommended that we should be establishing rules for a statewide STEMI program. A data registry needed to be created. The following year, regional programs should begin, and by the end of 2015, we should have complete regional STEMI programs. We got a D. We didn't get credit for the fact that we had some regional networks already in place. We didn't get credit for the work we were currently doing, but we kind of dropped the ball in 2009, and after the House Joint Resolution, despite our good intentions, we just kind of left everyone to kind of do their own thing. And so earlier this year, the initial focus from the state to these task force recommendations were focused on stroke and developing stroke systems and so forth. And so eventually the attention came back to STEMI. And so in January, a work group was established with multiple stakeholders. And this task force or work group was chaired by our colleague, Senator Dr. Alan Bates. And we were invited. The American Heart Association was invited. We had colleagues from public health. We had other folks, medical directors from the Legacy and Providence systems, and we got together to kind of talk about where we were at on a state level with regards to STEMI. And so the state wanted to know during these discussions is, well, you guys said you were going to, do the statewide STEMI network thing. Where are you? What are you doing? What are our current gaps for a STEMI system? They wanted to know, did we need a statewide registry? Did we need an advisory board? Should we be paired with stroke? And do we need some kind of legislative effort to assist in this development process? And so we talked about what constitutes an ideal STEMI system, and we talked about how we needed to increase public awareness of heart attack symptoms and appropriately utilizing EMS. We talked about trying to improve the EMS services, activating the STEMI process in the field, having local transport protocols, the STEMI referring hospitals. We talked a lot about needing to focus on the door-in, door-out time. The STEMI receiving hospitals, we had a lot of discussion on the need for participating in data registry and having uniform data registry participation, which we'll come back to. We talked about this need for an advisory board, and we argued with the state that we did not need to duplicate the efforts of the Oregon ACC and the AHA, and that we were well positioned to continue to support this effort, and that we could take ownership of this process. We felt that we were entirely different than stroke, and we didn't need to, while there were some commonalities, we didn't need to be paired with stroke. The STEMI registry, we again argued that we did not need to duplicate the current efforts. Most of the, if not all of the PCI-capable hospitals are participating in some NCDR registry. Not everyone was participating in Action or Mission Lifeline, and that concerned the state. And the state received a license through Mission Lifeline to access system-level data and view that in aggregate. But since not all institutions participated in Mission Lifeline, that data was not available. And so after this work group meeting, we asked ourselves as a chapter, well, what do we need to do now? So what we need is that we need all communities in Oregon to participate in a regional network and to pursue continuous quality improvement. These networks would increase public awareness, identify and eliminate obstacles for meeting our time to treatment targets. And we needed to facilitate formal growth of regional networks. And we needed to ensure participation in our data registry so that our system level, statewide level data could be analyzed. And in short, what we realized is that we needed to have another summit. So here we are. Now, before I talk about the goals of this afternoon, I just want to talk about effective goals. An effective goal goes by the acronym SMART. It's specific, it's measurable, it's attainable, it's rewarding, and it's timely. And if you think back to 2009, our goal was, well, we're going to establish a statewide system of regional networks. That's not really specific. It doesn't tell us how we're going to accomplish that. There's no time limit to that goal. And while it may be rewarding and we potentially could measure it, that really was not an effective goal. And so here's some examples of what I think are effective goals for our statewide efforts with dealing with STEMI. So by the end of this year, we should have a goal that every acute care hospital in Oregon participates in a STEMI network, in a regional network, and is either identified as a STEMI referring or a STEMI receiving hospital. All STEMI receiving hospitals should participate in action in Mission Lifeline, again in 6 months, by the end of the year. All STEMI referral hospitals and those EMS services that participate in those networks should participate in a continuous quality improvement process or a work group or a network that meet regularly with their STEMI receiving hospitals and to be able to organize that within 1 year. We should be focused on decreasing patient delay to first medical contact by 25% by 2015. Currently, the average delay is still about 2 hours. I know in Bend, we've had some media efforts to increase public awareness, and we have had small decrements in the patient delay times, but still well over kind of the golden hour. And so if we can reduce the patient delay by 25%, that'll reduce average times to about 90 minutes. Increase utilization of 911 by patients experiencing heart attack symptoms to 75%. Right now, I think it's under 50%. 50% of STEMI referring hospitals achieve a door-in, door-out time of less than 30 minutes by 2015. Currently, just a little over 10% of our referring hospitals meet the goal of 30 minutes. And then 90% of our eligible STEMI patients in Oregon receive guideline-based reperfusion within appropriate time targets within 3 years. So I think those are SMART goals. I think those are attainable, certainly rewarding for our patients. They're time-bound. We've set some limits. And so I think those are SMART goals. And so how do we start the process to meet our SMART goals? So for this afternoon, the goal for this afternoon is to reinforce the benefit and need for data collection and participation in action in Mission Lifeline. And Dr. Masudi and Dr. Patel are going to help us with that. We aim to identify STEMI receiving and referring hospitals in Oregon and develop a STEMI map of the state, and Dr. Rokos is going to lead us in that effort. Ideally, this should provide a a platform for members of regional networks to network, to get to know each other, put some names to faces. We're going to share best practices. Dr. Gross is going to lead us in a discussion of best practices, and Dr. Rokos is going to provide some nerdy details, I understand. And then throughout this afternoon, hopefully we can identify some obstacles where the state may be able to help. There may be actually some funding for some very practical obstacles that are identified. For example, in Oregon, in Central Oregon, I recently took a flight with our air ambulance crew, Airlink, out to one of our referring hospitals, Prineville. And the helipad is situated about 50 feet below the entrance to the emergency room. And there's this fairly steep driveway that the hospital staff puts patients on this gurney, and they roll the patient down this driveway, which during the winter is actually very slippery. And so that slows the transfer process. And so an idea that has come up is that, maybe we take some of that elevation gain out of the, out of play, put some new concrete down, and actually then have it heated so that, we're not having to plow that driveway. So just an example of an obstacle where if we had some funding, where the state might be able to help us. And then by the end of the afternoon, I hope that we can confirm our goals. The goals that I set forward certainly are not, these are goals that I've kind of pulled out of the air, but I think we need as a community agree upon some very smart goals that we can achieve and plan for next year. So we're going to start our daunting task. These challenges can be met, as Kennedy said. These are challenges that we are willing to accept, we are unwilling to postpone, and we intend to win, because we are no longer reaching for the moon, we are reaching beyond. Thank you again for coming this afternoon. Appreciate your participation.